Is bacteria in urine always a bladder infection? Imagine going to the doctor and having a urine test that shows bacteria. Does that mean you definitely have a bladder infection? Not necessarily. The presence of bacteria in urine can mean different things depending on your symptoms and test results. Bacteriuria simply means bacteria are in the urine. It is often defined as having at least 100,000 colony-forming units per milliliter of urine in a properly collected sample. But lower amounts can be significant, especially if you have symptoms. Sometimes bacteria are present without causing any symptoms. This is called asymptomatic bacteriuria. It is common, especially in older adults, people with catheters, or those with certain health conditions. Usually, it does not cause harm or need treatment unless specific situations like pregnancy or upcoming surgery are involved. A bladder infection, or urinary tract infection, involves bacteria but also requires symptoms like frequent urination, burning during urination, urgency, lower belly pain, or blood in the urine. When doctors diagnose a bladder infection, they look for both bacteria and signs of inflammation. White blood cells in the urine, called pyuria, indicate inflammation, but inflammation can happen for reasons other than infection. So, just finding bacteria or white blood cells does not confirm an infection. It's the combination of bacteria, symptoms, and signs of inflammation that helps doctors make the diagnosis. Proper urine collection is very important. If the sample is contaminated from bacteria on the skin or genital area, it can falsely suggest an infection. That's why a clean catch midstream sample is recommended. Urinalysis tests like dipsticks can detect nitrites and leukocyte esterase, which suggest bacteria and inflammation, but these tests are not definitive on their own. They need to be interpreted alongside symptoms and other findings. Sometimes bacteria are found in urine without any symptoms. This is often harmless and does not require antibiotics. This condition is called asymptomatic bacteriuria. It is common in certain groups, such as older adults or people with long-term catheters. Usually, it does not cause damage or lead to infection unless specific circumstances arise. It's important to note that bacteria in urine are not a sign of bladder cancer. While recurrent or persistent infections might prompt further testing, the presence of bacteria alone does not mean cancer. Bladder cancer symptoms can include blood in the urine or pain, but diagnosis involves specific procedures like cystoscopy and imaging. In practical terms, if bacteria are found but you have no symptoms, treatment is usually not needed. Unnecessary antibiotics should be avoided to prevent resistance. If you have symptoms like burning or urgency along with bacteria, antibiotics are often necessary to clear the infection and protect your bladder health. If infections keep coming back or if you notice unusual symptoms, your healthcare provider may want to evaluate further to check for other bladder conditions, including cancer. To keep your bladder healthy, stay well hydrated, practice good hygiene, and seek medical advice if you experience urinary symptoms. Remember, bacteria in urine does not always mean infection. A proper diagnosis depends on a combination of test results and your symptoms. Always consult a healthcare professional for personalized advice and treatment options.